Mr. Speaker, one of the most pressing health issues we face in rural Alberta is access to primary care and doctors. The Rural Physician Action Plan receives funding to place medical students and residents in underserved communities. Through these initiatives and others, RPAP promotes physician recruitment and retention in our towns and small cities. But there are questions swirling around whether the NDP supports this program at all. Our communities are already hurting. Let's end this uncertainty. Can the minister commit right now to leaving this vitally important program in place?
Minister of Health.
Thank you very much, Mr. Speaker, and to the member for the question. Certainly, RPAP is one of the programs that we're very proud of and has brought about many great outcomes for Albertans, just as the University of Alberta and University of Calgary, being physician training universities, have also brought about great outcomes. So I think the responsible thing for government to do at the end of a funding cycle is to review the objectives and review the outcomes. Certainly, RPAP will continue to exist, and we have continued their funding at the current level until the fall, while we continue to figure out how best to use the resources we have to make sure that physicians and all healthcare professionals are available throughout Alberta, Mr. Speaker.
First supplemental.
Mr. Speaker, given how important this program is to families across the province, it's a shame we can't get a real answer out of the minister. And seeing as she talks a great deal about giving Albertans access to the right health provider at the right place at the right time, will the minister take this chance to reassure rural Albertans and guarantee that our smaller communities will have the local access to doctors they need?
Hear, hear. Honourable Minister.
Thank you very much, Mr. Speaker, and let me be very crystal clear. RPAP will continue to exist as we move forward. I've said that in my first answer. I'll say it in the second and the third if you need to hear it. I think the responsible thing for us to do at this point is to look at all of the health professionals and how we make sure we can attract and retain them in communities throughout Alberta. Physicians are certainly an important component, but so are nurse practitioners, so are midwives. We're working on those, Mr. Speaker, instead of threatening to cut billions of dollars from the public treasury.
Oh, yes.
Well, at least she's actually committed to it too. It wasn't what she said in the first answer. She said she was reviewing it. This government spends a lot of time boasting about reviews, but it finds itself paralyzed with fear when it comes to taking real action. Why can't the minister bring herself to make a firm commitment to rural Alberta? Promise families in our towns and small cities that she will not gut their access to doctors, and promise to leave this plan in place and other plans to make sure we have access to doctors in rural communities.
Minister of Health.
I've answered the question, Mr. Speaker. We're absolutely committed to making sure that we have a stable healthcare system. That's why when we were first elected, we restored $800 million that was proposed to be cut from healthcare. That doesn't make sense, Mr. Speaker. Members opposite keep proposing more cuts. They keep talking about how important it is for us to make sure that we don't run deficits. I'm sorry, Mr. Speaker. The only way that's going to be happening is if we were to cut every nurse, every doctor. That's not going to happen, Mr. Speaker. The people of Alberta elected a government that stands up for public health care, and that's what they've got.